Well, I went to college at a small liberal arts Catholic school, Our Lady of the Lake University in San Antonio. Um, I selected that school because, firstly, I'm of Catholic background. Um, it was in San Antonio, which is a city with a long history of Hispanic heritage, so my parents felt comfortable that I was still in the community of my culture. And they, most importantly, they also offered me a full tuition scholarship. So um, I was very fortunate to go to that school. Uh, Retrospectively, I realized that it was really very important that I have a small community of friends who were very supportive through the process of my college education. The sisters who were largely the educators in the college were very supportive, very encouraging. Again, my chemistry professor, Sister Slater, was very instrumental in my, first of all, in being inspired to go to graduate school. And then when I told her that I might go to medical school, she was ecstatic. She was fully supportive of that. I felt always that I was being encouraged to be the best person I could be, and my education was very broad. It wasn't just about science, but I also had what I now realize as well was a very excellent education in the humanities, in literature, philosophy, which I loved, um, and uh, um, and social sciences, all of which really are very important, I think, to create a well-rounded education and perspective on reality. I went to medical school at the University of Texas here in Houston. After I made my applications to various schools, yet again, because I had limited financial resources, I went to the university. I selected the University of Texas in Houston because they offered me, again, full tuition scholarship. At that time, the school had a compressed curriculum in 3 years. So 4 years of education were compressed into 3 years. It was very intense, probably the most intense 3 years of my life, seriously. But I survived that, so internship was a breeze after that. I selected an internship. Well, first of all, I selected internal medicine as my specialty because of the various specialties of medicine that focuses on general medical care of adults. And why I loved my rotation in pediatrics, it is challenging and frankly, for me as an individual, a little heart-wrenching to see very sick children. So I was more appropriately, my disposition, my psychological disposition was more suitable for adults. And I liked being able to deal with, in a general sense, all the various systems of the body. In internal medicine, one deals with a little bit of everything: cardiology, pulmonary, gastrointestinal medicine, infectious diseases, endocrinological disorders, all across the board in a general way. So I did an internship in internal medicine and then followed a residency in internal medicine at the University of Texas in San Antonio. In the Hispanic population, cardiovascular disease, diabetes, obesity are all very common problems. And at the time, I thought I was interested in probably being a diabetologist. But as it turned out, my most interesting experience and most challenging rotation was in the oncology ward. So during my residency, I then chose and directed my next step of training towards cancer care. To specialize in cancer care, one must then extend training beyond residency into what is called a fellowship. And during fellowship, the training is focused in one very specific subdiscipline of internal medicine. So I did a cancer care specialty core training fellowship at the University of Arizona. At the time, at the University of Arizona, there was an area of focus, or two very expert physicians in the treatment of multiple myeloma. And I did laboratory research as part of my fellowship training, as well as clinical care. And at the end of my fellowship, I thought again that I would focus my further career in the treatment of multiple myeloma patients. But as it turned out, when I was offered a position here at MD Anderson, it was in lymphomas, which are a related group of disorders to multiple myeloma. All of these are disorders of the lymphatic system or of lymphoid cells. And that's where I've been for the last 24 years, treating patients with lymphoma.